Whenever you or a loved one requires urgent attention that does not need a trip to the emergency room, you can count on Salina Regional Urgent Care for all your medical needs. I am Dr. David Dupy, Medical Director of Salina Regional Urgent Care.
Well, Dr. Dupy, thank you so much for joining me today. We're going to be discussing the urgent care clinic. First of all, what types of injuries or illnesses do you typically see?
Yeah, so really we're here to help you with those urgent kind of conditions that you weren't able to get into your primary care, where it's more convenient to come see us but aren't emergent. So some good examples, cough, colds, we have flu, COVID, RSV testing that we can perform in-house. We have x-ray on site, and then if you have a fracture, we can splint and deal with most fractures and then get you on to see the bone doctor. If you require more advanced imaging like ultrasound or CT scan, we can get that arranged. We also can draw blood work if needed. We really can see and evaluate any condition. If we feel like it needs to have a specialty consultation, we can get that arranged, and we can kind of start the workup. Or if we feel like it's emergent, we will sure kind of facilitate getting you to the emergency room to get that care that you need. And we're really here for kind of those urgent needs that aren't life-threatening. So if you feel like something is, and I tell patients if it's severe or you feel like life-threatening, then really the emergency room is the best place for you. We can help you with that decision if you're not sure. If you don't think you need to go to the emergency room, you can always come and start with us. Or you can always hop on like a telehealth visit, and we can help kind of answer those questions and try to get you to the right place.
Why don't you explain how virtual care works?
Yeah, so you can check in online or call, and then the registration will get you hooked up, and then we will come on and see you over a computer screen, and then we can help decide whether we think you're a patient that needs to come in to get seen, or help kind of get you to the right place. So things that we can't really do over telehealth, like we can't really look at your ears. It's hard to look at throats. If you have bladder infection type symptoms, we need to test the urine. But if you have kind of cough, cold, any sort of like question, you're not sure whether you need to come in, we can always start you as a telehealth visit. And then if we feel like you need to get a test or you need to come in to see us, then we can have you come into the clinic, and it's all one office charge. So it's really best if you're not quite sure if you need to come in, or if you live out of town or it's not convenient for you to come in, then we can sure start you as a telehealth visit.
Well, Dr. Dupy, thank you so much for coming on the show, and thank you for watching. For more information, visit salinaurgentcare.com and like them on Facebook.